What I'm going to talk about is very, very common and needed, but don't think of it as a lecture. Okay, I'm not preaching you anything. We are just having a chat. So, we are going to talk about menstrual health and care during menstruation. So, you need to understand your periods. So, basically, the whole purpose of a woman having a period is her body is ready to get pregnant. And your body thinks that because evolutionarily, a female's job is to propagate the race. So, for which she needs to get pregnant. And your monthly cycle is the reflection of that change. So, when your period is about to start, your brain secretes some hormones. Then you can see in the diagram that the uterus is in the pelvis. This is the uterus. This is the cervix, vagina. There are tubes on either side and the ovaries. So, contrary to the popular belief, the ovary is not actually attached to the tube. It's separate, but the tube lies very close to the ovary. Okay. And every month it prepares a lining to receive the pregnancy. And if the woman doesn't get pregnant, the lining is shed as a period. And normally you should have a period once a month. It can last anything between 3 to 7 days. The blood will come out of the vagina. It is not because of some injury or a cut. It is just the top layer is sloughed off. Okay. This is a very simplistic version of a menstrual cycle that you start your period, then you bleed for 3 to 7 days. So the first half of your cycle, it's dominated by a hormone called estrogen. In the middle of the cycle, you release an egg that is called ovulation. The second half of the cycle is dominated by a hormone called progesterone. And if a woman gets pregnant, the pregnancy will continue. And if she doesn't get pregnant, the period will stop. And this will happen every month, ideally. And it's almost like your biological calendar. Okay. So this is a bit more detailed description. So this light blue line here, it's the FSH hormone. As its name suggests, it's a follicle stimulating hormone. So these are the small follicles. Now, the difference between men and women is men produce sperms on a regular basis, 5,000 sperms per second, whereas women are born with a set number of eggs. And the oldest sperm a guy will ever carry is 90 days old, even when the guy will be 90 years old. Whereas women, they are given a set number of eggs. So this number is roughly about a million, 10 lakh, the day you are born. And since then, this number only goes down in time. Okay. The rate of decline will vary in every person and even in the same person at different times in their life. And when you run out of them all, the condition is called menopause and you will stop your periods. So what happens is the follicle stimulating hormone is coming from your brain and then your ovary selects few number of follicles. We call it recruitment. So the follicles get recruited and they produce estrogen hormone and that builds the lining of the uterus. Now, in the middle of the cycle, the LH hormone has a surge. So its level suddenly increases and shoots up, and that causes you to release this egg. And once the egg is released, the follicle collapses. It becomes corpus luteum, which secretes the progesterone hormone. And that makes the lining juicy to receive the pregnancy. And if a woman gets pregnant, the pregnancy will continue. If she doesn't get pregnant, the corpus luteum dies after 2 weeks. the progesterone and estrogen levels drop, the blood vessels at the bottom of the lining, they shrink, and the top two layers of the lining get sloughed off as a period. Okay. So how you might feel during periods. You might get a bit of mild abdominal pain, lower abdominal pain, sometimes back pain. You might feel a bit tired. Your moods might change. You might crave certain food types. Some girls actually may not feel anything. Some might just feel mild discomfort, and everything is normal. Okay, except the extremes. But just because somebody doesn't have pain, that means something is wrong, or somebody has mild pain doesn't mean that something is terribly wrong. Okay, so everybody will be different. And as I said, that it's like a clock. So obviously, when you will start your periods around age 11 or 12, the first year or so, the cycles will be a bit irregular because your body is getting used to its own rhythm. But eventually, once it's found its rhythm, you will know exactly what's going on. So some girls might develop pimples before they start the period. And once the period finishes, the pimples will go away. Or you might experience a bit of breast tenderness, or you might start having a little ache in your lower tummy, or you might have slightly increased vaginal discharge. So you will know all these signs, and you will know that my period is going to start very soon. Okay. So how do you take care of yourself during the periods? You need to rest whenever you need to. You need to drink plenty of water so you're well hydrated. You need to eat healthy food. Gentle exercise is absolutely fine. Walking, stretching, swimming, whatever you like. Sometimes some girls might need hot water bottles for lower abdominal pain, and sometimes you might actually need painkillers. Okay, but in an ideal world, if a period is normal, it should not stop you from school or any other activity. Okay. Now, during the menstruation, hygiene is very, very, very important. Okay, for keeping you clean and healthy. So these are some of the menstrual products. So you might have seen or you might be using some of them. You might not have heard of them. So this is a regular pad, which majority of you will be aware of. This is a menstrual cup. It's made of silicone and it practically folds, and then you fold it and then you insert it in the vagina, and then it opens in the vagina close to the neck of the uterus, and the blood collects in it, and then you have to keep changing it every few hours. These are the underpants which have inbuilt pad in them, and this is a tampon, and these are the pills. Okay, so sanitary pads, period underwear, cloth pads, because in India, it's quite common that some of the girls might be using old clothes, which is absolutely fine, provided they're clean. Okay, and changing of the pads every 4 to 6 hours. But this is just a guide because it is quite possible that in the beginning of your periods, your bleeding might be a little heavier. So if your pad is soiled badly, you might have to change it a bit earlier. But 4 to 6 hours, what it means is that even if your pad is not soiled enough, you have to change it. Because as you know, the vagina is between your legs, that place is quite sweaty. So if you keep the pad there for a longer time, it will work as a culture medium for bacteria from the skin to grow, and that can lead to infection. So we don't want that. Okay. So if bleeding is heavy, sooner whenever you need to change it, that's absolutely fine. But 4 to 6 hours, even if it is not soiled, you need to change it. And need to make sure you wash your hands before you change the pad, and as well as after you change the pad. And whatever product you're using, make sure that you wrap it properly and dispose it off properly, because it is a biological waste. Okay, and it can lead to unhygienic conditions, as well as it may spread infection. So it is very, very important that whichever product you are using, you dispose them of responsibly and sensibly. Okay. What to do during periods? You need to make sure you take shower or bath every day, wear clean underwear, and keep your private parts clean. What you don't need is do not use any soap inside the vagina. Okay. The simple reason is nature is very, very clever. In the vaginal lining, we have a bacteria. It is called daughter-lens bacilli. And what they do is they break down the glycogen in the vaginal wall and turn it into a product called lactic acid. And this acid keeps the vaginal pH acidic, so less than 7. And that is very, very important to keep the vagina healthy because that acidic pH stops the growth of harmful bacteria and fungi like Candida. So no matter how the product is Ayurvedic or natural or homeopathic or pH balanced, please do not use any product inside the vagina. Plain, simple water is enough. And you don't need to be feeling ashamed about the periods. It's very natural. Okay. It is like you are eating, drinking, going to the toilet, sleeping, everything. This is a very, very natural process. So there should be no shame or guilt attached to it. So you don't need to hide your periods or anything because they're not dirty. Okay. There are quite a few myths and and we want to break them. So lots of times some girls have said that you should not play. And as I said, a normal healthy period should not stop you from anything as long as it is healthy and legal. So no, there is no restriction. You can do any activity which you feel like as long as you feel comfortable. Period blood is dirty? No, it's not. It's just a normal blood mixed with the cells from the lining of the uterus. Okay. There is another myth that only adults get periods. No, there are certain pathological conditions where girls as young as 7 can get periods. Obviously, they need to be seen by the medical professionals to find out the reason, but no. And you can't eat certain foods. Again, that's very, very wrong. So, as long as you're not allergic and preferably healthy eating, everything should be absolutely fine. And we recommend healthy, balanced diet. Okay. When you need to tell an adult or a doctor, it's if your bleeding is very heavy. As I said, that you would by now know your body's rhythm, you know your loss. So let's say, for example, for last few years your period lasts only 3 or 4 days, you're changing like 3 to 4 pads a day and period finishes. But say suddenly this month it's gone to like 7 days, or for last couple of months it is going on for like 7 to 8 days or 10 days, or instead of changing 4 pads you have to change like 6 or 8 pads, um, or there is a severe pain stopping you from any activities, or you're needing regular painkillers. Periods are just going on, even if it is spotting, not just necessarily just heavy bleeding, or you're feeling scared or confused, you talk to your mother or teacher or a school nurse or a doctor. Please, please, please. Okay. So, in summary, puberty is normal part of growing up. Periods happen once a month and they last for few days. You always need to use clean pads and change them every 4 to 6 hours. You need to bathe daily and wash your hands before and after you change your pads. Drink water, eat healthy food, and rest whenever needed because periods are not dirty or shameful. And talk to a trusted adult if you feel worried or unwell.